liver. So, as you have already learned earlier, that liver is the largest gland in the body and it is situated in the upper right quadrant of the abdominal cavity. Now, the nine abdominal quadrants, which we have earlier covered in under the peritoneal cavity and abdominal cavity. So, the liver is situated over here in the right quadrant, okay, and it secretes bile juices and performs various metabolic functions. This is the basic features uh, which I already mentioned in the lower classes as well. So now, majorly, the locations are important where the liver is actually situated. So the liver is actually situated in these four regions. Majorly, it is situated in this right hypochondrial region, but due to its larger shape and its lobe, it is extended even to a little bit towards the other areas also. Like major portion of the liver lies over here in the right hypochondrium. It shifts a bit towards the epigastric region, then towards the left hypochondrium as well. Then it comes below as an inferior border and lies over this right lumbar area and then gets covered like this. So this is the average shape, wedge shape of the liver which is present. So it covers four basic areas: the right hypochondrium, the epigastric region, the left hypochondrium, and the right lumbar region. External shape of the liver is wedge shape. It is wedge shaped, and general normal weight is around 1,600 grams in male and 1,300 grams in females. Morphological features based on the surface, border, and lobes. We'll classify the morphological features. So, morphological features are, since it is a wedge shaped organ, so imagining the organ in that sense will help in understanding the surfaces, the lobes, and the borders of that particular organ. The surfaces are five. How the surfaces are five? They are in this manner. The frontmost is the anterior surface. This surface entirely is the anterior surface. Behind this surface will be the posterior surface. This above surface will be the superior surface, and since it is a bell shaped organ, it is resting upon some surface. That some surface on which the entire organ is resting is the inferior surface. Below this border will be the inferior surface, and then last on the right hand side will be the lateral or the right lateral surface. So these are the five prominent surfaces of the liver: anterior, posterior, superior, inferior, and lateral or right surface. Then there is one prominent border which is being very prominently seen, which is this border, that is the inferior border of the liver. Then there are two lobes present. One is the right lobe and the left lobe. These right and left lobe are separated by this ligament, which is called as the falciform ligament. It is clear over here in this diagram. This is the right lobe and this is the left lobe, and in between there is a ligament which is separating these two lobes, which is the falciform ligament. This is about the basic morphological features or the external features of the liver. Now, these are the lobes which are being discussed over here. So, lobes, majorly there are two lobes of the liver. If we look externally or an overview of the liver, there are two lobes. One is the right lobe and another one is the left lobe. Now, it is important to know that which all ligaments are present that are separating actually the two lobes of the liver. So, if we see anteriorly and superiorly, the lobes are divided by the falciform ligament over here. This is the superior surface and this is the anterior surface. So superiorly and anteriorly, the lobes are getting divided due to the falciform ligament. Here. Then this is superiorly and anteriorly. Now inferiorly, the liver is being divided by the fissure for ligamentum teres. There is a ligament which is called as ligamentum teres, which is actually a modified version of a remnant of an intraembryonic feature, which will be covered under embryology. This is the ligamentum teres that is separating the right and left lobe inferiorly. And lastly, posteriorly, the left and the right lobes are being separated by the ligamentum venosus, which is also an intrauterine uh, left out organ which is being modified into the body. So this is the fissure for ligamentum venosum, which is separating the right and the left lobe posteriorly. Clear? Then the right lobe, it is larger than the left lobe, obviously. And now there are two major lobes which are present within the right lobe. The division is such that the liver is actually majorly divided into two lobes, the right and left. Then again, the right lobe is divided into two lobes, caudate lobe and quadrate lobe. One is the caudate lobe and another one is the quadrate lobe. And this is present where? It is present on the posterior surface of the right lobe. Now what is caudate lobe and what is quadrate lobe? So over here in this diagram, the lobe which is being present over here is the caudate lobe, and one which is marked with the dotted areas over here is the quadrate lobe. So what are the borders which are surrounding the quadrate lobe? Now look into this diagram. This is the caudate lobe. Now borders on the right side, it is bounded by a groove for IVC, that is inferior vena cava. This is a groove for inferior vena cava which is present on the right hand side of this lobe. Then on the left side, it is bounded by fissure for ligamentum venosus. On the left side, it is being guarded or bordered by this fissure, which is the fissure for ligamentum venosum. Then inferior side, it is bounded by porta hepatis. There, there is a structure which is present over here, which will be termed as porta hepatis. So the caudate lobe is bounded by three borders. On the right side by the fissure for by the groove for inferior vena cava on the right side. Then on the left side by a groove for fissure for ligamentum venosum, and inferiorly it is bordered by the porta hepatis. Clear? So this is the caudate lobe. Next is the quadrate lobe. The quadrate lobe is present actually below and it is situated in the inferior aspect of the right lobe of the liver. On the posterior surface of the right lobe of the liver is the caudate lobe, and on the inferior aspect of the right lobe of the liver is the quadrate lobe. Now, what are the borders which are surrounding the quadrate lobe? So, on the right hand side, it is bounded by fossa for gallbladder. See, this is the quadrate lobe. So on the right hand side, it is guarded by or it is bordered by a fissure for the gallbladder. This is a fissure which is actually made onto the inferior surface of the liver so that the gallbladder shape is getting fitted into that fissure, and it is being placed safely over there. So on the right hand side, this quadrate lobe is being bordered by the fossa for gallbladder. Then on the left side, it is bounded by the fissure for ligamentum teres. Over here is the ligamentum teres. So on the left side, it is being bordered by the ligamentum teres. Then on the superior side, it is bounded by the porta hepatis. Above it is the porta hepatis. So superiorly it is bordered by the porta hepatis, and then inferiorly by the inferior border of the liver. So these are the four borders of the quadrate lobe. On the right side by the fossa for gallbladder, on the left side by the ligamentum teres, superiorly by the porta hepatis, and inferiorly by the inferior border of the liver. So these are the two lobes which are under the right lobe of the liver. One is the caudate lobe and one is the quadrate lobe. Again, caudate lobe is situated onto the posterior surface of the right lobe, while quadrate lobe is present on the inferior surface of the right lobe. Clear? Now, very important part, that what is porta hepatis. So porta hepatis is actually a structure which is present on the posterior surface of the liver. Now it is a deep transverse fissure about 5 centimeter long, and it is situated on the inferior surface of the right lobe of the liver. Where is porta hepatis situated? It is situated onto the inferior surface of the right lobe of the liver. It lies in between the caudate lobe above and the quadrate lobe below, as we have seen that the quadrate lobe has its inferior border as porta hepatis, and the quadrate lobe has its superior border as porta hepatis. So porta hepatis lies in between the quadrate lobe superiorly and the quadrate lobe inferior. Now, what are the structures which are passing through this porta hepatis? So, portal vein, hepatic artery, and hepatic nerve enter the porta hepatis. Very important. The structures which are entering into the porta hepatis are portal vein, the hepatic artery, and the hepatic nerves. While the structures which are leaving the porta hepatis are the right and left hepatic duct which are leaving the porta hepatis. So, structures entering the porta hepatis are portal vein, hepatic artery, and hepatic nerves. And the structure leaving the porta hepatis are right hepatic duct and left hepatic duct. This is all about the right lobe of the liver, while the left lobe is much smaller than the right lobe and it does not harbor as much structure that the right lobe harbors. This is about the basic morphology, external morphological features of the liver. Now, next topic, which is the relations, that is the peritoneal relations of the liver and its surfaces, will be covered in the next lecture. Thank you.